All right, so the game plan was conscious sedation to put the dislocation back in place. And I was scared as crap because, like I said, at this point, pain had already set in. And I think at this point, I might have had two fentanyl on the table through my IV. And I was like, oh, you're going to do what? You're going to touch it? Don't touch it. Like the x-rays are hard enough. So anyway, they explained to me what conscious sedation is. They make me sign all these papers. I'm scared. I'm like, what is conscious sedation going to do to me? You got me signing my life away, asking me if it was a lot. And they were like, oh, well, we're just going to put you under with this medicine in your IV. And when you wake up, you're not going to feel nothing. Now, mind you, to someone sitting in a bed that's never been through this, whether as a nurse or as a patient or as a supportive person to a family member that's had this, I'm sitting here like, you going to do what? And you going to do who? And you expect that I'm not going to feel no pain? I don't think so. So anyway, I was all nervous or whatever. They assemble a team. The team comes in. They do the full timeout. They ask me all the timeout questions. What's my name, date of birth? What are they about to do? And I'm looking at them like, and they're like, is the code card? Is the code card here? Do you have this? The respiratory therapist standing over there with the ambu bag. I know what the ambu bag is for. I ain't crazy. And I got two nurses verifying how much medicine and I'm like, what is going on? So anyway, they start the procedure. I'm laying there. I look at the nurse who is actually putting the medicine in my IV, which was not my primary nurse. She was over here at the computer scanning some stuff. And the nurse over here, and they say, you gonna push the medicine, the solution? She's like, yeah, I'm gonna push it. And I'm like, okay. And so I look at her and I said, ma'am, I said, I don't feel nothing. She said, oh, well, I'm putting it in your IV now. You'll feel something. I don't want to, rush you all at once. And I looked at her and I was like, ma'am, I don't feel anything. And the next thing I know, baby, it was lights out. When I woke up, that foot was sitting back up right like this and it was wrapped up. Okay. So I can't say that it happened quickly, but what I'm telling you is that medication puts you out. You don't know nothing. You don't know what's going on. Obviously, they had to manipulate my leg and then, of course, wrap it in place. And when I woke up and was like, oh, my leg is hurting. And she was like, okay. She was like, let me check your vitals. Let me blah, 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 blah. Okay. And so she did all of that and she proceeded to ask for, me to have some medicine after the fact. But I don't know what happened during that reduction or put that foot back in place, but thank you, Lord, that I remember none of it. I just remember waking up.